Guys, Dr. Mike Silvestri here with Silvestri Chiropractic and Wellness in New Township, PA. Wanted to talk to you today about heart health and how you can keep your heart healthy. And I wanted to do this essentially from a chiropractic perspective. So the first thing I wanted to discuss with you is what's the basic function of the heart? Well, the heart pumps blood throughout the body. Blood, of course, is a very important fluid in our body, carries oxygenated red blood cells to all our tissues. Okay, so the basic function of the heart is to pump blood throughout the body to get the oxygen mainly that it needs. And then, of course, as we talked about in other videos, the lungs take in oxygen, remove carbon dioxide as well. So, of course, the heart and lungs are very interrelated. If you want more information about the lungs, you can refer to my previous video about lung health. The next thing I'm going to talk about is the actual neurologic supply to the heart. Okay, and what areas of the spine actually, therefore the nerves supply the heart. The first thing is, this is your spine from the side. Each individual segment in your spine, they're called vertebrae. When we talk about the heart, there's two very, very important areas of the spine we need to look at. And that one is up here in this C1 area. This is called C1 for cervical spine, vertebrae 1. And essentially, the reason why it's so important for the heart is because the brain stem sits right up in here. The reason why that's important is because there's nerves on each side called the vagus nerves or the vagal nerve that essentially supplies the heart. Would it make sense if you had a twisted atlas that way or a twisted atlas the other way, that would interfere with your heart function? Of course. It might cause an arrhythmia, it might cause high blood pressure, it might cause other types of heart dysfunctions. The next area of the spine that also supplies the heart this is called your thoracic spine here. So it's this T1 to T4 area in this area right here. Right up in this area, all these spinal nerves coming out from the side here supply the heart. Okay, now it's not exactly the spinal nerves, but I'm making it a little more simple, of course. Remember when we talked about in other videos, we had the sympathetic nervous system and the parasympathetic nervous system. So in the brainstem with the vagus nerves we talked about, that's parasympathetic, rest and digest. It slows your heart down, decreases blood pressure, decreases the strength of contraction of your heart, and then essentially we have a sympathetic portion here in the T1 to T4 area that speeds your heart up and basically does the opposite, increases the strength of contraction, increases blood pressure, increases heart rate, things like that. So that's what we need to look at on the spine. Now, how does this integrate with chiropractic? Again, if that's twisted up in the cervical spine, that makes sense that it interferes with spinal function. What if you had a subluxation here? We talked in my other videos about subluxations. What if your spine was twisted like that? What do you think that's going to do to these nerves here? Of course, it's going to decrease the function of the heart. Remember, this nervous system supplies every single cell, tissue, organ in the human body. When you get adjusted, of course, we get this vertebrae back in alignment with an adjustment, we allow the nervous system to function and its optimal level. I also wanted to show you a little bit more detail about this and give you an appreciation about how the nervous system functions as it relates to the heart and what the nerve supply to the heart actually looks like. As you see here, this is the heart in the center of the chest here. This is called the thorax. And you see the vagus nerves, left vagus nerve, and the right vagus nerve that comes down here. It gives a nice showing of that and how it actually comes down here. This is your trachea, this is your thyroid, to give you an idea of what we're actually looking at. So it's pretty amazing, the nerve supply to the heart. And this is exactly what I talked about here. This is your brain stem via the medulla oblongata. This is the vagus nerves on both sides, and you can see how that supplies the heart right there. And of course, that's parasympathetic. Okay, so parasympathetic, rest and digest. And then we have the sympathetic side of things, which is T1 to T4 for the thoracic spine. This is actually your spinal cord right here. Okay, so this is the spinal cord, and these are the nerves coming out right here. So it's pretty neat to see how this actually works. As you can see, there's a lot of different nerves here that go to the heart sympathetically as well. So just to give you an appreciation there. What's the first thing you should really do? I mean, if you have a heart problem of any kind, whether it's high blood pressure, an arrhythmia like atrial fibrillation, something like that, whether you have heart disease, whether you have heart failure, there's various different names we can give dysfunctions to the heart. The first place you should try is a chiropractor. Why? Because we have to get the nervous system supply to the heart as best as possible, as highly functioning as possible. That's the first step. The next step, of course, your heart is dependent on various nutrients. And the number one nutrient I would really say is potassium. Okay, potassium is extremely important for heart function, and most people don't get enough potassium. The next important nutrient would be magnesium. Magnesium is ultra important as well. A lot of people are deficient in magnesium. The next one would be omega-3 fatty acids. You can get this from fish, of course. The next one would be something called coenzyme Q10. A lot of people are taking statin drugs. Hopefully you're not taking a statin drug, but if you are, you definitely need to take coenzyme Q10. And then the last couple, very important but definitely not least, is oxygen. Oxygen is extremely important for the heart. The heart is beating thousands and thousands and thousands of times per day. It needs a lot of oxygen. It runs through a lot of energy during the day. So oxygen is extremely important. And then the last one I would say is water. A lot of times an overlooked one is water, because you need good, adequate hydration for the heart to function right. So guys, I hope you got a lot of great information out of this video about heart health and how you can improve your heart health with chiropractic care and getting the optimal nutrients to your heart. If you have any questions for me, please give me a call at 412-302-7526. Be sure to like the video and subscribe to my channel and be on the lookout for more videos in the future. Just a reminder, guys, we are still holding our $25 new patient consultation and exam, and that is continuing. So, and we do that, of course, for a service to our community right now in the challenging times. Have a great week, guys. Stay happy and healthy, and I'll see you soon.